to care for those who once cared for us is one of the highest honors. The United Nations in 1990 designated October 1st as the International Day for Older Persons. The theme for this year is Digital Equity for All Ages. We here at Treat by Alterdoctors present to you a small snippet of what geriatrics is and why it needs to be given more relevance in our country. Now, it is projected that there could be 138 million elderly people in our country at this point of time, with the numbers expected to increase by more than 56 million in the next decade by 2031. Among the 21 major Indian states, Kerala has the maximum proportion of elderly people in its population, followed by Tamil Nadu, Himachal Pradesh, Punjab and Andhra Pradesh. Now, these findings are from the National Statistical Office publication entitled Elderly in India 2021. These huge numbers at the background reflect the need for a specific health cadre attuned to the needs of the geriatric population. Well, there may always be question marks as to why should there be a separate specialty. Well, just as how pediatrics exists as a separate specialty training to take care of children as they are different from a medical viewpoint from adults, elderly with a vastly changing physiology, metabolism, multiple underlying comorbidities do need a healthcare personnel trained in treating them, and this is where the specialty of geriatrics or geriatric training comes into the fore. Old age comes with its unique set of problems, the most common of them being immobility, instability, incontinence and impaired intellect or memory, which have been grouped as geriatric genes. Now, it is in this area that a geriatrician is trained to identify, evaluate and provide solutions. A geriatrician is not meant to substitute the role of a nephrologist or a cardiologist or any of the other specialties. Rather, he or she becomes the point of contact to provide integrated holistic care for the patient, encourage screening and to ensure timely referrals to other specialties. The role of the geriatrician doesn't just end there, but involves ensuring compliance to the treatment prescribed by other specialties and to monitor any side effects if it does occur due to multiple drugs, which most often the elderly receive due to multiple underlying diseases. A geriatrician also maintains a constant follow-up of his or her patients to monitor for bone health, vaccinations, and also engages with the rehab teams of PMR and physiotherapy to ensure a good quality of life. This International Day of Older Persons, let us ensure that the elderly in our family have a comprehensive checkup by doctors who are trained in the field of geriatrics. Let us ensure that the elderly are not discriminated because of their age and have equal access to resources. And may the growing digital space be inclusive of the elderly with regards to their rights, security and privacy. On the occasion of the International Day of Older Persons, this was a special presentation from Treat by Alterdoctors, because our motto is enlighten, empower and entertain. Thank you so much.